Good morning, everybody. My name is Cindy Morris. I'm the Vice President of Development and Community Engagement here at ASA, and welcome to our latest ASA Live. I'm really ready to have this conversation today. We are talking today to Christina Marnares, who has been for the last 24 years developing and implementing traditional and innovative programs for older adults and family caregivers. As the Community Services Manager at the AAA Area Agency on Aging and Disabilities of Southwest Washington, she oversees over 20 programs and services, including the Aging and Disability Resource Center, Family Caregiver Support, and Access programs. We are talking today to Christina. First of all, welcome, Christina. Hi.
Thank you, Cindy. It's so good to be here with you today.
Thank you for doing this with us. You know, our ASA Lives are meant to be really easy access to just a small, like a dash of learning that you can fit into your day really easily. And one of the things that I really appreciate about them is the way that we're learning from each other, right? How can we take the little piece of what you're doing and integrate it into what we're doing to make everybody's work a little easier and a little more effective. So thank you for doing this with us.
My pleasure.
So let me explain to everybody what's happening. The Area Agency on Aging and Disabilities of Southwest Washington is located in Vancouver, Washington. It was a 2021 runner-up for the John A. Hartford Foundation Business Innovation Award for its Community and Paramedicine program. This Community Paramedics program supports high utilizers of emergency medical services and patients with frequent hospital admissions and those with barriers to successful discharging back home. This probably is going to remind some of you who watched our last ASA Live, same issue. And now we're going to be talking about kind of another way that it was managed. This program was helping patients and families confront the challenges around what was really happening. What were those social determinants of health, the disabilities, the aging access services, and really providing support that could maximize independence and quality of life in their home and community, while improving those medical outcomes and reducing those 911 calls, reducing those hospital readmissions. So today we're going to be really diving into this again. I think this is going to be interesting because if we remember from our last conversation, we kind of heard one solution. So it's going to be fun for us to kind of dive into what was an alternative option here and how did this one work? So first, Christina, can you start off? Tell us about the Community Paramedicine program a little bit.
So our program serves adults who are age 18 and older with complex health and social needs. And the program supports high utilizers of the emergency medical services and patients who have frequent hospital admissions and those who have barriers to successfully discharging back home. And essentially, we have a staff person. It started with a community paramedicine nurse and it's now a case manager. We've had some staff transitions. And they engage with the patient to help them identify what are their unresolved needs. And then they work to connect that patient to services and supports that can help improve their ability to remain at home. And it really, you know, we talk a lot about reimagining the care team, and this program really does that on all levels. It really reimagines having community-based organizations like ourselves at the table with healthcare, with EMS, and as partners really collaborating on how do we bridge those gaps in care. It meets the patient and their family support systems where they're at and really listens and understands what their gaps or their barriers are to being at home and addresses those needs. So I just really appreciate that about the program, is it really is reimagining the care team and looking at how do we improve access to care.
Yeah, I mean, we were just talking about, right, the need to support the caregiver in daily life. Before we started this conversation, we were talking about the fact that caregiving is a very real part of this process, and finding those supports for the care recipient and the giver sounds really integral to what you were doing here. What led you to develop this program?
Well, the county that it's located in, which is Cowlitz County, has traditionally been one of the poorest health outcomes within the state. And so it just demonstrates the need for programs and resources like this. But as we were working with our local fire departments, they identified 3 key issues that was contributing to high repeat call volumes and having an opportunity where community paramedicine might help improve those outcomes. And the 3 issues that they identified was folks needing help with chronic disease self-management, behavioral health needs, and mobility issues.
Interesting. And so let's dig into those outcomes. What are you seeing now?
Well, we really are seeing that this is a proof of concept that we can implement key features of a community paramedicine program that includes workforce and infrastructure that helps serve a small patient population and connect them to local systems of care. And one of the things that we value most is our EMS partners are in fact reporting that they're seeing a decrease of non-emergent calls, which really obviously allows them to focus in on those calls that require a higher level of service. And we're really fortunate that also part of this work is our local hospital system. And they also are very happy with the progress that we're making with the program. We are seeing referrals come in, and the outcomes of that referral is not just the service that they get in community paramedicine, but our capacity as an area agency on aging to refer that client to ongoing services that support long-term care. And that's probably the biggest impact that we have, is this is the introductory service, right? The front door for the patient. And then we can stay with that patient and that family, if need be, to continue ongoing supports that really reduces that need to access the higher level of care.
Yeah, I mean, as I'm listening to you, I think one of the things that I've heard you say is we can only do this for so many people, right? Because it is a rather hands-on process. Mm-hmm. And so the fact that you, as a AAA, then have access to directing them to other services that can be their support means you aren't having to come up with reinvention of the wheel concepts and processes. You're catching them in your net and then releasing them into the right space, is what it sounds like.
Exactly. And sometimes it's within our space, and sometimes it's with community partners. And even community paramedicine, when we launched it, we aligned it with the ADRC. We saw this as being a companion program to transitional care services. And that was done intentionally, because as we looked at pilot to sustainability, we wanted that to have we wanted it to have a permanent home. If we saw success in the program, where were we going to embed this long term? And so that was done intentionally.
Yeah, I love that. As we think about kind of when you create those pilots and that learning process, how do you ensure the sustainability and build the funding to really ensure that it can continue on past that moment where you get that initial, let's test this out funding, which is really key here. So, you talked a little bit about what the clients and partners are valuing about this. Can you tell us a little bit a success story? Do you have like a great story you can share with us?
Sure. So one of our first cases was a referral to the nurse, and it was for Catherine. And when she arrived at the home to greet Catherine, she found that Catherine's legs were red, they were swollen, and they had large wounds on her, or she had large wounds on her shins that she had sustained from falls. And those wounds were discharging fluid that puddled at her feet. And Catherine's wounds were untreated due to a lack of transportation. So, and sadly, these are the types of situations that we're meeting in the home. And so it really explains, their need to access services. And so the nurse worked with Catherine to review her medications and develop a list of items to discuss with her physician, to include home health for the wound care and physical and occupational therapies. And the nurse also informed the doctor of the wounds and requested a follow-up for Catherine. And so the doctor's office was then able to schedule an appointment, and they were also able to arrange transportation. So that reduced one of her barriers, right? So she's not calling EMS to transport to the hospital. And then the doctor addressed all of the items that was on the list that the nurse and Catherine had developed together. And so in addition to that, Catherine wasn't aware of her ability to access assistive equipment. And so the nurse worked with her to find the equipment that she needed, and a way to pay for those equipment pieces. And as we checked back in with our partners, that fire department shared, the quote from them is, "I think I speak for everyone when I say how awesome it is that she is finally getting some help. I saw her yesterday and she was very excited about getting more help. It was a complete change in attitude and emotions. Thank you for what you're doing. You guys have done some amazing work with her." And this is really, I mean, it's great praise for us as a AAA, but this is totally a collaborative effort. The partners who are at the table include EMS, the hospital, behavioral health partners. So it's a group effort. And I think one of the beauties of this program is it's situated in a rural county where service providers know each other. They see each other often. And so that coordination of care, I think it can be easier than it can be in larger cities, just because of the other contact that they have with one another.
Yeah, I think that would be huge. And one of the things that I really loved about what the story I just heard, right, is that when the firefighter wrote to you, he referenced her mental health, right? You addressed her physical health. The impact went so far beyond the wounds on her legs, directly into the mental health aspect of this and living with this chronic issue that it sounds like, right? And what that was doing.
Right.
And so often when you're floating through that 911 cycle, those mental health pieces aren't addressed. And that's really what you were able to do, which will lead to all sorts of positives for her. You know, so what's your next steps? This was a pilot. What's happening next?
So, you know, obviously long-term is, now that we're seeing that there's success as measured by the partners as well as us, we're wanting to move this into a permanent suite of the part of the programs that we offer. And so a first step to that was actually the hospital reaching out to us and saying, "Hey, we love the results that we're seeing in this program. Can we help fund this program so that it can be expanded?" So that's awesome, right? And we have to knock at the door beyond the partnership investment, right? And so that was wonderful. And I should clarify, the initial part of this funding came through our accountable community of health, through our 1115 waiver program. So we were able to receive funds to launch the pilot. And then from there, Peace Health came along and said, "Hey, can we, further support this program?" And then our agency has invested as well. And so, again, we wanted to take it from pilot to how do we move to sustainability. So it's looking really promising at this point, I think.
That's really exciting. There's nothing like when your partners see such great results that they're coming to you and saying, "Can we fund this?" Right? Like that's the moment.
Yes, definitely.
Right. So, so what we really want to think about here is now, how do we take this program, and you're looking at sustainability, how do we reinvent it for others? So what is what's the one big thing you want to pass on here? What's the big lesson you've learned that you think others should follow?
Yeah. So for me, from my perspective, I think that it's valuable to have your key partners at the table as you're beginning planning, implementation, evaluation, and quality improvement. Relationships matter. This program did not happen because we sat down at the table one day and said, "You know what we should do? We should do a community paramedicine program." Before any of that happened, we had strong partnerships with our fire departments. We had strong partnerships with our healthcare providers. We had made connections and routinely met with behavioral health providers. We have a strong aging and disability resource center. So all of that infrastructure was in place and being built all along as an area agency on aging. And from there, as we talked about what's the need in the community and what are some possible solutions, we built on that foundation. So I would say relationships matter. I also think co-designing matters, and that really supports sustainability. If you understand what each partner, what their pain point is and what their capacity to contribute is, it really just allows for that grading of not only funding, but also resources. So we're huge fans of co-design. We also were mindful of what data could we share, what data did we need, and consequently, what was the need and capacity on the other side from the partners as well. So it was upfront. We all knew what we could do, what we couldn't do. And then in addition to that, a look towards quality improvement. And we do that in a few different ways. There are regular meetings where the operational side gets together and they meet and they talk about not only cases that we're currently working on, but what's going on, who else needs to be at the table, how do we get those folks at the table in terms of service providers. And then in addition to that, for example, the case manager meets routinely with the hospital care team. So there's really great communication going back and forth. And then at an administrative level, we're meeting once a quarter to talk about what's going well, what are the opportunities for improvement, and what's next. And then, as I've shared earlier, we started thinking this needed to be a nurse position. Mm-hmm. And what we've learned is that both work really well, whether it's a nurse position or a case manager, because the nurse doesn't actually do direct care. She was really facilitating things like connecting to the doctors, making sure that med rec was done and so forth. So anyone who's trained in transitional care services could really facilitate that same level of work. The current case manager has a really rich background in care coordination. And so we felt like that was just a really nice match, right? We just leveraged her previous work experience into this role, and things are going well. So there's, flexibility there, because I know sometimes, just in terms of staffing, it may be more difficult for AAAs to bring in a nurse versus a case manager. And so both models work.
It's, one of the things that I'm listening to you talk about, it was really something similar that we heard last week. It was like, work with your partners, listen to what they really need. Don't assume you know what they need. Mm-hmm. And don't try to fit that square peg into your round hole, right? Like, right. We need to really find what's going to work here. And the result of that, as you're describing it, really gets into the fact that they're able to see those results. And that's where we come down to it. We talk about it all the time. Metrics, right? Nobody cares if all you're saying is, no, we're seeing it. They care when you can really quantify it, or using qualitative data, right? But really, mm-hmm. those metrics make a difference to the movement into the sustainability side of this.
Right.
Yeah.
And I so appreciate at our quarterly meetings, we can talk about that. We can share the data. We can hear from each discipline what they're observing. So we get that data component, but we get that narrative too from each of the perspectives.
Yeah, and I love the way you were using the skill set of your staff. So often, we all bring a history to what we're doing. And so not only is that amazing for the program, but it's amazing for his or her professional development as well, right? There's something special about that, as well as really valuing the person who's taking this on, and letting them feel that ownership and feel that connectivity with it. Yeah.
Absolutely. It's funny that you say that, Cindy. I just completed orientation yesterday for a new employee, and I asked her, what is it that matters most in your work? And she shared, really what matters most to me is the ability to collaborate. And so if that's really where they're coming from, bringing programs like this to fruition must feel so rewarding that, not only can they see the impact that they're making with the clients, but they can also see the impact that they're making with our partners and to our larger community in terms of bringing us to wellness. Definitely.
Yeah. And as we all look at how can we support our employees now more than ever, giving mm-hmm. them that space is enormous. I love that question you asked. I'm gonna steal it if you don't mind and start using it.
Definitely.
We're just onboarding a new staff member as well. In fact, ASA is onboarding a new staff person. She's not on this call, but if you're attending our conference at On Aging, you're going to be able to meet her in New Orleans. Kay Link has joined us as our new digital comms manager. So actually, I hope if you all are coming to our conference, April 11th, that you try to meet her. She'll be around doing a lot of live tweeting and kind of getting out what's happening at conference into the world. But we're very excited to have her. So I hope you all get to meet her as well. I just thought, oh, there's a plug. Speaking of plugs, I'm going to plug for a moment because we do have a couple really big things happening just in the next week and a half, and we want to make sure everybody catches them. April 1st, which is around the corner, is our Managed Care Summit. This is an annual tradition. This is a really important program. It's a few hours of your day, and it is all virtual this year. So last year, we of course went virtual with it, and we were excited to be able to bring it virtual to everybody again, because we know that brings it to a broader audience. So please make sure that you have signed up for our Managed Care Summit. That is really, really, really important. The other big event is happening April 4th. We are doing our very first Future Proof Live. It is coming through, being brought to us by Generations. We are going to be talking about ageism and technology and what that looks like. How do we fight ageism when we are utilizing tech? So, and thinking about tech design and tech access and tech employees and all of that. So please join us April 4th. Make sure you have signed up for it. It is a completely free event. It is completely virtual, but don't miss out on it. And as always, because similar to our web seminars, all of these events are on our calendar of events, which is right on our website, asaging.org. So please make sure you've had a chance to sign up for those and you join us. These are going to be really fun, I think, and a good way to get a taste of what happens at On Aging. If you aren't able to join us in New Orleans, we're going to miss you. You can still register to join us. So it's a way for you to get a little bit of that learning that you would have gotten if you were able to come. If you are joining us, this is a really good way to get into the spirit, minus the beads, I suppose, but everything else will be there. So, so anyway, Christina, thank you for doing this with us.
Thanks for having me, Cindy. I enjoyed it.
Yeah, I really enjoyed getting to talk to you. And I think what I want to encourage everybody to do is to watch this ASA Live and share it, and then go back and look at last week's, because these are two very different approaces to the same issue, and similar results, right? So it's not about always having to create, take every detail and reinvent it, but there's going to be pieces that you can pull from each of these as you're thinking about how do you manage those 911 calls in your community, those hospital readmissions. What pieces of each of these can you bring to your own story? And it's fun to hear about how are they handling it in a rural community versus how are they handling it in a more urban setting or suburban setting, right? And what really can work for you. So please utilize both of these. And let us know, message back to us. We'd love to know, did you get something out of this? And are you kind of stealing a tidbit of advice and bringing it to you? We would love to hear that, and we'll share it with our guests and let them know as well. Christina, thank you.
Thank you. Have a great day, and I'll see you in New Orleans.
See you in New Orleans. I can't wait. Make sure we say hi.
Definitely. Take
Bye-bye.
care. Bye.